Hello, everybody. So, the topic that I will be discussing is the differences of health conditions among cultures and genders in the Latino community. Here's my disclaimer. So, let's begin. Based on cultures and genders, the risk of having health conditions vary drastically. Within the Latino community, there are many who are immigrants, which can affect the probability of risk and diseases based on their gender and socioeconomic status. So, what are the health conditions that are present in the Hispanic community? On the Hispanic Health website, I saw two images that show the 10 leading causes of death and the top diseases and risk factors for the Hispanics. So, between non-Hispanics, whites, and Hispanics, we see that within the Hispanic, the diabetes and chronic liver diseases and cirrhosis are the leading causes of death. On the other side, we see the top diseases and risk factors between US born and foreign born. And we see that those who are not born in the United States have a less percentage than those who are born here in the US between obesity, cigarette smoking, cancer, and heart disease. So, an article by Vargas stated that Latino children with immigrant parents who may have experienced the protection of the immigrant health advantage during their early 8 years may be more vulnerable to poor health than their parents as they age. What does this mean? That these kids will likely have more health issues than their parents. Why? Because parents have different beliefs. Parents have different remedies in which to cure these conditions, while these kids are more prone because they're in a different country with different medical care. So, what about socioeconomic status? Another article stated that undocumented immigrants are particularly vulnerable since they face unique risk and exposure to traumatic experiences before, during, and after migrating that put them at a high risk of mental health distress. So, what does this tie with? This ties with the idea of them migrating to a different country, having to cross through many states, many cities, the conditions that they're driving in, the conditions in which they're walking, sometimes crossing rivers. You don't have water, you don't have good foods and everything, so that exposes them to more health conditions. So, to conclude, in regards to health, each condition can differ with age, gender, and cultures. The key factor in order to maintain a good lifestyle is being educated on this subject and taking action. Our lifestyle is affected by many factors like socioeconomic status, genders, and cultures due to our beliefs or religion. Society and parents are important role models for children to maintain healthy lifestyle behaviors, which these habits can continue through their lifespan. Have a great day, everybody.